So you've been diagnosed with borderline personality disorder, and you might be feeling a lot of different emotions, a huge spectrum. You might be feeling overwhelmed even more so than you had been. You might even feel a little bit of relief because there is a name for what you've been experiencing. But either way, you're probably wondering, okay, like, what do I do with this information? The first thing we're going to do is just sit and meet yourself with as much self compassion as you can. Getting a diagnosis of any form can be, like I said, a whole spectrum of emotions. We want you to be kind to yourself, and start to feel grounded in this reality and kind of check in. Like if you're feeling like you're resisting your diagnosis or you feel like you're just accepting and ready to go, really just tune into yourself because it can help dictate kind of what your next steps are. But when you're ready, when you've kind of gone through that first step of just like being kind to yourself, it's time to start building a support network. And that will look like a couple of different things, honestly. Um, First and foremost, the number one way to treat borderline personality disorder is with therapy. And so we're going to try to help you find someone who specializes in this type of disorder. There's so many complexities and nuances with how somebody with borderline views and kind of navigates their world that having a specialist is super important. So you're going to be looking for therapists that have this specialty, and that will also probably come with them specializing in dialectical behavioral therapy or DBT. It is a form of talk therapy, and we'll get into that a little bit more. But in brief, it is a form of therapy that was designed specifically for borderline personality disorder, but more specifically, it's for people who experience really intense emotions, need to learn how to navigate impulses, and then starting to develop some healthy dynamics when it comes to building and maintaining healthy relationships. So that's first what we're going to look for, and that treatment can look like a couple of different things depending on your own insight and awareness and kind of where you're at in the process. So you could go into a treatment program that includes group therapy, individual therapy, and skills coaching. Or you might find that you can do just individual therapy while building kind of your outer world of support. And that's where we're going to start looking for being vulnerable with your friends and family and starting to create a network where people understand you and you have the space to learn and grow and develop these skills. So that's talking to your friends and family that feel safe, maybe even getting into online communities or support groups in the community. And once you take those steps, it could unleash some other sides of support. So you could get a psychiatric evaluation to see if there are any medications that might be helpful in managing some of the big moods. But once you meet with your provider, you will kind of start to put a map together and triage or kind of prioritize what symptoms of yours need the most support and kind of go from there.